Dr. Graham, and we will ask you some questions. Next on our agenda is Dr. Janet Heinrich, who is the Associate Administrator for the Bureau of Health Professions at the Health Resources and Services Administration in the U.S. Department of Health and Human Services. The Bureau of Health Professions provides national leadership in the development, distribution, and retention of a diverse, culturally competent health workforce that provides high-quality care for all Americans. Very happy to have her here.
And I am very happy to be here. I'd like to pick up on the note that this is just the beginning, and we are very, very busy in the implementation process. And also like to pick up on your note that we need more targeted approaches if in fact we're going to make any difference in the number of people who are from ethnic, racial backgrounds that are minorities in the workforce. And today I just announced that we will have a senior advisor in my office for the National Health Workforce Diversity Initiatives in the Bureau of Health Professions. Certainly increasing the diversity of our healthcare workforce is one of the priorities of HRSA, and we're very serious about moving on that front. You know, obviously, that HRSA isn't only about workforce. That is where you are seeing the expansion in the National Health Service Corps, the expansions of the community health centers that includes school health. We've had the implementation of the new program for home visitation of mothers and babies in the Bureau of Maternal and Child Health. And there are also special initiatives that cut across all of HRSA. In fact, in some instances, the whole department related to oral health and behavioral health. But let me focus on the workforce issues. So the Affordable Care Act reauthorized many of our programs and also created many new programs. But primarily the focus has been on increasing access to primary care services, as God said, and expanding the work that we're doing to increase the number of nurses, primary care physicians, dentists, and allied health providers. So one of the first programs that I want to say something about that really does target minority groups for participation in the healthcare workforce is our Health Careers Opportunity Program. That's a program that was on the books, but it was expanded in terms of funding. And so that program actually encourages youth, high school students, to enter the health professions. There's $60 million that's authorized for that program. Our Centers of Excellence also have not only the African American, Black, minority focus, but it also has the Hispanic focus and American Indian focus. And that program was authorized and the funding expanded. There are scholarships for disadvantaged students. There are now $51 million authorized for 2010 and such sums as necessary in the future. The nursing workforce diversity programs have also been expanded in the law. Although in this fiscal year, 2010, we have the existing pot of money for those programs. I've heard cultural competence, linguistic abilities several times this afternoon. There is authorized a new program. It builds on a previous program that was not funded. And this program is for cultural competence, prevention and public health, and individuals with disabilities to essentially support the development, evaluation, and dissemination of research, demonstration projects, and model health professional curriculum. So this, in fact, would provide the opportunity for some of the testing that you, in fact, were talking about. And we'll see what happens in terms of the funding for that program. Our area health education centers, and we have several across the country, also encourages people from diverse backgrounds to participate in the health professions. The legislation changed the names, expanded the purposes that the area health education centers must be engaged in, but certainly it allows for innovation in the way, again, that we encourage youth to participate in health professions careers. Another really interesting area for the area health education centers is that they have a specific requirement now for recruiting individuals from underrepresented, disadvantaged, or rural backgrounds, as well as conducting interdisciplinary training. With our program for primary care medicine and dentistry, these programs also are authorized for additional dollars, and the programs are now 5 years instead of 3 years in length. And there are preferences there for training physicians and dentists who come from underrepresented and disadvantaged backgrounds. Now, you may have heard something about our health profession shortage designation program. The shortage designation programs have implications for a lot of different areas, certainly issues in payment that affect CMS, but also rural health clinics, GME residency slot redistribution now, the National Health Service Corps, and certainly community health centers. We've just announced the formation of a committee that is required by the law to go through a negotiated rulemaking process, and they will begin their meetings, which are open to the public, beginning this fall, probably late September or early October. But it's an area that we encourage people to be involved in because it does, in fact, affect the way dollars and resources can be distributed. And I would be very happy to answer any questions. I do want to say that it was just very exciting to be a part of the President's Special Initiative in Primary Care, where $250 million was provided to expand training for primary care physicians nurse practitioners, and physician assistants. Those announcements just closed this week, and we had a wonderful response. But it's clear that we're very serious about expanding our